I've had 8 treatments so far, and the relief is just wonderful. I can work around the house some now. I can work in my yard, which is something I dearly love, and I can walk longer than the 50 feet that I could walk before. It's just been wonderful.
And I had cataract surgery on my right eye, and got along fine, but I had a lot of scumming and trouble with my left eye, and the doctor scheduled me to go in and said that I would have to have surgery on it. I went in and he tested my eyes, and he left eye again, and he said, well, I am so surprised. He said, it's not bad at all. He says, it's hardly grown at all. And I said, well, I have been taking treatments from Dr. Tong, and I said, I have also noticed that it is clearing up, and I don't have the scumming and the problems I had. And he said, well, no, he says, it's hardly grown at all. He said, the treatments are working. He said, continue with that. He said, come back in 6 months, and we'll test you again.
The case of Maureen illustrates how illogical and potentially harmful conventional treatment can be. This patient had her leg bone surgically broken in an attempt to lessen the pain on the part of the knee joint where the arthritis had eroded the cartilage. After surgery, not only was her pain worse, but the fracture failed to heal after 6 months. Another surgery was recommended. Maureen declined and went to Dr. Tong instead.
I have had a lot of improvement in my walking and less pain, and I'm able to walk now without crutches and without a cane, and my walking's a lot steadier. And I was very nervous about having another x-ray taken because my bone had not healed since 5 to 6 months, and I went and had an x-ray done with my orthopedic surgeon, who is a very well-known surgeon. And the x-ray shows that the bone is starting to heal, and there's callus formation on the left lateral side where before there was none. And so this is a really good sign, and my surgeon has recommended that I continue with my treatments with Dr. Tong, and I'm very happy. The bone from my tibial osteotomy, which is now healed thanks to Dr. Tong's treatment, and I'm still having pain in the knee from arthritis, and my orthopedic surgeon prescribed a medication for me called Daypro, which is a non-steroidal anti-inflammatory, and after taking this medication for 4 days, I developed problems with ulcer. I'd had ulcers in the past, and my ulcers started to bleed, and I had severe stomach pain, nausea, and vomiting with blood in it. And my gastrointestinal doctor wanted to do a endoscopy to look down in my stomach, and I came that same day after I left his office. I came to see Dr. Tong because I knew that he would be able to give me treatments to help with the nausea and to help my ulcer heal again. And I was also having a severe headache, especially in the forehead region, and after coming here the first day and having treatment, my headache's now gone. My nausea's much better. I haven't had any more vomiting since I had my first treatment with Dr. Tong. I've had my second treatment now with Dr. Tong, and since I'm continuing to feel better, I'm not vomiting blood anymore, my nausea's better, I've decided that I don't really need the procedure of the endoscopy, and I'm going to continue here with my treatments with Dr. Tong. And I've had a week of treatments now with Dr. Tong for my problem with nausea and vomiting blood, and I am feeling 100% better. I haven't had any more episodes of vomiting, and my nausea's a lot better. I'm going to be going back to work next week, and the treatments have saved me the costly expense of an endoscopy and possible surgery, because with a bleeding ulcer I might have needed surgery also, and that would not be necessary at this point.
Dr. Tong recommended a shoe lift to even out the difference in length of her legs, which eventually corrected her problem with limping.
And I've seen, several other orthopedic surgeons. No one ever recommended that, which when I look back on it, seems like a simple thing, but it was Dr. Tong that recommended that, and it's really helped a lot.
The patient continued to improve under Dr. Tong's treatment. She was eventually discharged and has been doing well for the last year without further treatment.
Dr. Tong has saved me probably thousands of dollars and my insurance company in terms of preventing surgery. The first surgery he prevented was hideous surgery that I was going to have done on my knee, where I would have a frame attached to the bones to wire them together and try to make them heal through compression. And by healing my tibia, Dr. Tong, that was one surgery with a lot of pain and disability. He saved me. And now he saved me from the endoscopy, which would have been very expensive, and possible surgery on my stomach if the bleeding had continued. So this is all time lost from work, time I would have been in the hospital, and expense for the procedures and surgeries that has been saved, and also saved for my insurance company.
The surgery itself cost $100,000 at $400.
Dr. Tong has been a genius as far as I'm concerned. I wish that our whole people in Medicare knew the difference in dollars and cents compared to the $40,000 or $50,000 that was spent on me and came to nothing.
So the total cost of the surgery came to about $30,000 when you add everything together. And you have to remember that before the surgery, there was roughly another $30,000 just getting myself prepared for the surgery. Now, that would have all been all right if it had worked out, but unfortunately, I came out of that hospital feeling worse than I did when I went in.
Besides the money wasted on surgeries, billions of dollars are spent on drugs and side effects of drugs for chronic ailments. Billions or more are spent on research to find newer and more powerful drugs. However, the stronger the drugs, the greater the side effects. And the best we can ever expect out of this would be only symptomatic suppression with no possible cure. So the only solution is to have a treatment that's capable of reversing the disease and interrupting this endless waste of energy and resources.
In the next part of our program, we shall illustrate how neurobioenergetic treatment can help personal trauma, sports and work injuries, accidents, and save billions of dollars on disability and loss in wages. Dr. Tong's East-West Wellness and Pain Center is located in Costa Mesa at Harbor and Adams. For more information, call 1-888-DR-TONG-1 or 714-556-8664. You can learn more about Dr. Tong's treatments by listening to patient interviews and viewing case histories on our website at www.drtong.com.